As you probably heard, the 2019 novel coronavirus has started an illness outbreak in December 2019 in China. And now the virus continues to spread to other countries. The World Health Organization has declared that there's a global health emergency outbreak due to the 2019 coronavirus on January 30, 2020. It's sad to know that people who are affected by the new coronavirus have experienced some mild symptoms like cough and fever. But before we panic, especially if you need to travel overseas, it's a nice idea to get yourself familiar with this virus. I'm here to help you know what the coronavirus exactly is, how we can protect ourselves, discover whether or not there's a cure, and so much more. So let's start discovering the 10 things you should know about the 2019 novel coronavirus. Number 1. So what is 2019 novel coronavirus? First, let's talk about what makes 2019 novel coronavirus different from other coronavirus. The coronavirus, which was first detected in Wuhan, China, is part of the single-stranded RNA viruses called Coronaviridae, a type of virus affecting birds, reptiles, and mammals. So what will happen if this coronavirus affected humans? We may experience mild infections the same way with a common cold. As for more serious infections, these are very rare. However, the virus can cause neurological and enteric diseases. The previous coronavirus outbreak includes SARS, also known as Severe Acute Respiratory Syndrome in 2003, first reported in southern China, and MERS, also known as Middle East Respiratory Syndrome back in 2012, identified in Saudi Arabia. In comparison, the 2019 novel coronavirus have less severe implications. Number 2. Where does 2019 coronavirus come from? You might hear that the market in Wuhan province in China is where the 2019 novel coronavirus is suspected of having originated. The virus comes from the animal reservoir. This means that the virus is infecting animals. Whenever the virus tries to replicate, it typically replicates in just one animal. Then, the infected animal will pass it to another animal. This virus does make the jump to humans. However, when they do, it's because they are consuming the infected meat, which has not been prepared or cooked properly. Number 3. Is there a cure? Okay, so let's make things clear. So far, there are no specific vaccines or medicines that can cure this new virus. Even the antibiotics will not work. Although there are existing treatments, affected people can get better on their own. It's not true that you can protect yourself against the virus by gargling or swallowing salt water. There's no need also to take steroids or acetic acid or even use ethanol, essential oils, salt water, and other substances. Number 4. How effective is it to wear face masks? For sure, you might be seeing people wearing face masks from the news, or you might already encounter people wearing them in the streets. However, little do you know that wearing face masks are not that useful. There is only limited evidence that they actually work, simply because they do not cover our eyes and are generally loose. Besides, you should not wear them for long periods of time. Number 5. How can we protect ourselves? According to WHO, you can protect yourself against coronavirus by covering your mouth and nose with your elbow or a tissue while sneezing. If using a tissue, put it straight into a clothesbin. Other than that, you also need to wash your hand more frequently than usual with soap or use a sanitizer. At least 1 meter. Keep a distance from people who are sneezing or coughing. Number 6. Can pet cats and dogs be infected? There's no evidence that animals like cats and dogs can be infected by the coronavirus. You cannot catch the virus from them either way. However, it does not mean that you should not wash your hands under running water and soap after touching them. Number 7. The 2019 novel coronavirus is contagious. First, people who were diagnosed with the coronavirus were linked to a seafood and animal market in Wuhan, China. This suggests that the case happened through the animal-to-person transmission. During the incubation period, the new virus becomes contagious. The symptoms may appear anytime between 1 to 14 days after the exposure. People with existing medical conditions or older people have a higher risk of contracting the virus. However, people of any age have no exemption from the infection. Number 8. It is safe to eat food from China. No need for you to stop or avoid buying Chinese food, despite the fears happening on social media. It is also safe to receive letters and packages from China. The new coronavirus cannot survive for long on surfaces like door handles and cups. People who have returned from Hubei and Wuhan province in recent weeks and have been in close contact with people there tend to have the highest risk of being infected. Number 9. How does the laboratory test identify the new coronavirus? During the lab test, health professionals will look for the viral RNA, which looks like a jigsaw puzzle. In case a person speaks and the jigsaw puzzle fit exactly, it will slide right in. Tools in detecting RNA comes with enough of a pattern, so not all virus can slide right in, meaning it should come with the right sequence. Number 10. Where can we find the most reliable information about the new coronavirus outbreak? One of the main reasons why other people got into a panic is that they get information from unreliable sources. It's best for everyone to go to similar information sites that clinicians, public health workers, and epidemiologists use. There you have the 10 things you should know about the 2019 novel coronavirus. I hope you gain new ideas about the new virus, and let's stay healthy together. I will see you the next time.